Okay, so this is our discussion for difficult patients, phone a friend. We're gonna start with the question, what's been your most difficult patient? So what was your most difficult patient you've had?
My most difficult patient is probably one of my athletes would just come in daily and have something new. Like even if it wasn't a big thing, it was like either mental, they felt like they tweaked their ankle or tweaked their back, or this hurts, that hurts. Somebody is always gonna hurt. Like you yourself is always like there's something always gonna be wrong with you, and you're not always gonna feel like 120%. So that was kind of frustrating because I felt like some of the things I couldn't control and I couldn't fix all the time. So that was my probably most difficult patient with that aspect.
So I think I didn't have a patient that came in and complained about something every day. It was just frustrating that we couldn't figure out what was wrong with one of our patients. So it was just frustrating that like we tried like what we knew to do and we couldn't like figure out like diagnose her or something. So I hadn't had the experience that she had like with a patient coming in and complaining of something every day. But I'd say it was just frustrating how we tried everything we knew and it still wasn't enough to figure out what was wrong. So if we kind of jump back to the question before, like how do we break our culture? I think this like would help in this scenario that we would like change the way we would like either ask different questions or go about the like evaluation, like the eval differently, or like involve different people that we should talk to get their opinion on things. I think that's something that we need to start to like think outside the box because we're in such a routine. Like, we get when we learn this stuff, we're given just a sheet of like evals and you just read, and you have to memorize the list. And I think we get into that routine a lot when we're like evaluating patients. And I think we just need to like take a step back and just like think about it, not just like, oh, what else was on the list? And I think that would, if we step and like think about that, I think that would definitely benefit like how we like diagnose and treat patients overall.
I agree. I think that if we, take some time to like really think about it, maybe say to the patient, well, let me gather like all my information, past experiences with this, and not just go straight to what we always do when this, like they feel the way they do, and we just jump to that conclusion and say, you have that. I think we should kind of like take time and really think about it. And also, I think having other people like be included with this is really good for like figuring out an injury or anything like that, because they know something that you don't, and like bringing other knowledge and everything like that is going to help for the best like outcome for the patient.
And I think like in this, when it talks about this is like in ourselves, and I think sometimes we get so caught up in like our own busy days and like we're there for that rotation. So I think we get frustrated, like we just come in frustrated to begin with. And I don't think that helps us in like our clinical sites whatsoever, because like we're there like, oh, I have to go to practice, I have to sit here for like 3 hours, like not do anything, and we're already like upset and frustrated. Like we have obviously we have our own lives like going on outside of things. And I think a lot of that like carries over into like, oh, here we go, like somebody's hurt, like now I have to do this. And I think that's something like if we change like our mentality, like when we come in every day, I think that can like also like help our athletes.
So separating like our life too from our job, I think.
Like with the relationships with patients, I know I had an athlete one time that I don't know if I had done something that she didn't like agree with, that she didn't like, but she didn't really come to me for things. So I kind of like took a step back and try to just be more helpful with her like altogether. So like, I mean, I don't know, I kind of just like changed the way I went about things, like asked her like, hey, can I help you with that? Not like, oh, let me do that, like just step in and like take over the situation. So I think that was something I had to change in like a relationship with an athlete. But I don't think I've really had to deal with any other, like I haven't had like a, like a rough situation, like it was not good between me and an athlete.
No, I'd agree. I've never had a problem with an athlete, but for like how to manage a relationship, when I said about the person that came in with something new every time, it just made me had to be more positive and not fake it, but kind of just think, well, maybe this is happening and they're not just making this up or complaining. They're really hurting, and I need to help them as their clinician, and I need to help them as their student athletic trainer to help them feel better. And they're not just complaining every day about something new. It's actually something very important. So I think managing that relationship was kind of hard, but I think we need to go about more, like, as student ATs, we need to be like more positive, because sometimes I think we're like, oh, they're just friends, like they can wait, or
Right.
we treat them as friends, and we should treat them as patients, not friends.
Yeah, in one of the articles, the first one, the one that was like 7 pages or whatever, I like how it like broke down, like it gave you that scenario, like the lady, you already had a rough day, like you're behind schedule, like you're stressed out, and the lady came in, complained of something new every day, like she was a smoker and then complained about that. And I really like how it broke it down in each scenario, like each like phrase, and was like, here's what you can do to like kind of help. And I think, and like, yeah, it's frustrating to kind of like, okay, let me think about this whole situation and like figure out what I can do differently. But I think if we would take the time to kind of do that with everything, I think that would totally change how everything went with,
Yeah.
I mean, every relationship, not just like athletes.
When we're having a bad day, the last thing we want to like hear is somebody else putting more
Right.
complaints on ourselves. So I think that if we just, that's why we're so selfless in this job, is because
Yeah.
we have to put others in front of ourselves. So I think that if we just are more selfless and really think they didn't really do anything to help, like they're just coming to you because they know that you know your stuff. So
Right. I was saying kind of on that, like, it's frustrating when kind of like about that whole scenario and like people aren't getting better and they're like, well, what can I do? And like rehab, like nobody wants to do rehab, you know? Like we had a girl that was supposed to do ankle rehab every day, and like she would come in like once a week, if that. And then she would complain when she gets hurt and fell and got hurt again. But then it's frustrating for us. Like, what do you say like when you have an athlete, like, because like we can't sit there and do the rehab for them, you know? So I think that's something like, that's definitely a situation I didn't think about before, but that's something you need to, like, we have to think about more often, you know, like how can you like go about it differently, saying you can't just come out and say like, oh, well, it's your fault, like I told you to do that and you didn't, like that's not helping anybody. But yeah, that's definitely a situation that comes up a lot, I think.
I agree. Into a difficult patient. What do you think some of the factors which contributed to your difficult relationship?
I think for me, and not even in the athletic training world, but just in general, that like when I'm like mad and had a bad day, like I take it out on everybody else. You know, like it doesn't matter who comes up or who's in my way. Like if my mom calls me, like if I'm already in a bad mood, like she hears it. You know, I think that's something that like I obviously like have to work on, but that's something I notice a lot. Like I take out on other people, and I think like it's really good. Like think about all this and like break it down. Like listen, like I know I've had a bad day, but you gotta push it all aside. Like deal with this. So I think that's something that is challenging with relationships.
For me, I'm like all about like a list and stuff. So like when one thing happens on top of another and it just like keeps piling up, I get like super stressed out and I like just I can't handle it. So I need to work on that as well, which I've tried to not get as stressed out and like do a couple things at a time and like tell myself it's gonna be okay, because when like a lot of things pile up, I just freak out and think I can't get everything done, or I get ultimately stressed out, and I just need to like calm myself down and know that I can, like, it's all going to be okay, because I immediately think it's not going to be. It's going to be okay.
I think in other situations can come in, like when we think about this, like other like student ATs that like we argue with, you know, or like even preceptors, you know, that like they don't let you do things or they do something differently and like you're afraid to like step up and be like, why are you doing that? You know, so I think like not just like managing like difficult people, but like also managing like situations in general is important, because I feel like sometimes like it definitely us as students, when there's like an issue that comes up with a preceptor, like we're definitely afraid to say anything, you know, so I think that's something that this could be helpful with also, like, because usually we don't want to step up and be like, I think, because like I mean I know I've had things that happen like when like we did my preceptor did ultrasound one time, and I was confused, like, "Why are you doing ultrasound?" Like, I don't but, like, I didn't wanna be like, "I didn't think you should be doing that," you know? So I feel like
Mhm.
that's helpful to be like, "Ooh, how do you go about it?" Like, better than just be like, "You're wrong," and
Mhm.
so
Okay. Um, what has been a struggle and what has been beneficial with, I'm assuming, the difficult patient?
um, I think just, like I think definitely the biggest struggle is, like, having an athlete that doesn't do, like, rehab, if we're
Mhm.
just talking about like that. Um, I think that's one of the biggest struggles we have is, like, ATs most of the time.
Motivating our athletes.
Right, yeah, ones that get hurt and they're like, "Oh, I get to hang out on the sideline," you know, like, not have to do
Mhm.
anything. But I think, like, it's beneficial for us to, like, see, like, when an athlete, like, they get better, like, that's so rewarding for us, you know, like,
Mhm.
we did it and they did it, like, right, and they're back to play and stuff. But sometimes, like I said earlier, you just have to, like, go about it differently with rehab, like,
Mhm.
we changed up the rehab, like, made it more fun and, like so then she actually, like, enjoyed it, like, rehab's never fun, you know,
Mhm.
like, nobody enjoys I mean, most of the time, like, doing rehab.
Mhm.
So, I mean, like, that's something, like, you thought about the situation different, and then, like, I think that's something that
I agree. Rehab's never fun. It's something that people want to do, and they don't really think about the long run, like how it could help them. And so they just see what's in the now. And now it looks like it's just boring stuff that doesn't help. But um, it's beneficial in the end, and I don't think the athletes see that. So it's difficult for us to encourage our athletes to do
yeah.
something that doesn't look fun at the time. But I think if you just keep reminding them, like, this is the day that, like, this is the deadline we want you to be back to
Right.
play, and this is what, like, the progression we want to see, and then you can finally play in that conference game or
Mhm.
finally play in that one game you always wanted to.
Yeah, and definitely on the flip side of that, when you have an athlete that's just, like, gung-ho about getting back and, like, they're
Mhm.
doing things, like, too quickly, you have to be like, "Hey, like, here" you have to think, like, that's completely different, you know? You have to kinda, like,
Mhm.
step back and be like, "Okay, like, definitely different, like, they wanna do it, but they're doing it too much, so they're hurting themselves even more, and that's just, like, a whole different situation." You kinda have to, like, sit back and, like, think about how you're gonna handle it.
Mhm.
Yeah, so that's it.